The views expressed on the following program do not necessarily reflect the views of Money Radio staff, management, or advertisers, and do not represent an offer to buy or sell any securities. Some interviews heard on this program may be sponsored by the participants. It's time for Health Futures with Cypress HomeCare Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and it must be Friday, and indeed it is. It's the last Friday of August. Man, we are just flying through 2020, and I'm happy to report for fellow Phoenicians and people here in Scottsdale, it's kind of a cool day today. It's only 100 degrees. It's usually at least 110 by now. You know, an interesting fact is that we smashed a record here in the state where it used to be the 33 days of 110 degrees or more was the record in our state, and we're at 48 that are 110. And I believe in the month of August we had 11 days that were 115 or higher. So it's really nice to get August behind us and hopefully some of the cool fall temperatures here in front of us. So I am not a weatherman. I am the host of this incredible show called Health Futures, and Health Futures is a show about how our older adult population can live a healthier, happier life. And how do they do that? They do that by listening to the show because I get extraordinary guests here to the show, and today's no different. I'm really pleased to have Dr. Johan Samanta here in the studio. Can I call you Johan?
Absolutely. Thank you for having me.
Johan, thank you for being here. And, you know, I want to talk about your practice because this is such an important area. And I want to learn more about how you got into this specialty. But you're a neurologist specializing in movement disorders.
Yes, yeah, exactly. And movement disorders, for those of you who may not recognize that term, is really just a collection of neurological conditions that either involve folks sort of having not enough movement, sort of Parkinsonism and the like, or having sort of excessive involuntary movement, so tremors, chorea, tics, and something called dystonia. That would kind of cover a lot of it. So,
you know, it's funny because Johan and I got a chance to talk just before we got into the show, and you know, I was describing him, someone I knew, a couple people that I knew, and he knew them too. And what a really small world. And you know, one of those folks, you know, was that on that excessive side, excessive movement. And, you know, you were part of the introduction here in our state of this thing called DBS. And I know it's only one of the treatment protocols that are out there, but DBS is something that is referred to. It's an acronym, and we use lots of acronyms in healthcare and in medicine.
Yeah, that's part of medicine, seems like, yeah.
But it's deep brain stimulation. Right?
Exactly. Yes. Yep. So it's you can almost think of it like a bit of a pacemaker, but for certain targets in the brain. And the idea is you place an electrode with quite literally what looks like a pacemaker battery pack, or what's called a pulse generator, and you drive current through a particular target within the brain, and there's a few different targets that we use these days. Actually, there's sort of a growing number of them as we start to use this technology even in epilepsy and depression, and have been exploring it even in dementia, experimentally at least. So the idea is by sort of running this adjusted or adapted current. And we can control frequency and the length of the pulse and the intensity of the pulse. Then it sort of, in a very simplified way, sort of recorrects or brings back a more stable firing pattern to this circuit. And in Parkinson's, that sort of helps mimic more normal function and can really alleviate symptoms. The same thing with tremor, both for Parkinson's and for familial tremors.
It just blows my mind. They talk about Star Trek, space being the last final frontier. The brain is really the last final frontier. There's so much we don't know about the brain, and to be able to do something like that is just so fascinating. And this one individual, we were talking about him before. I mean, he was tremoring big time, and he was a beautiful person, just a really wonderful person to get to know. And he told us about his surgery, and when I saw him about a month later, I was just blown away. I mean, just no tremors at all. He was like perfect.
Yeah, it really is a small world. We talked. You brought up two people, and they happen to be folks that I knew very well over the years. And the person we're thinking of, just a really wonderful guy who had been suffering with Parkinson's, and it just had become very difficult to control the symptoms with just medication, or at least with the medication the options that we had at the time. And especially what was difficult for him was his tremor. And, I had the privilege of, many years ago now, being there when his device was actually turned on. And, you don't get, you get a little cynical over the years as a doctor, but there's a handful of moments in your life in the office where you get a little choked up because something is just so amazing. And you see the expression on people's faces. We were sort of tuning in his settings, and you just watched that tremor go away, and you watched his arm relax and his face relaxed. And then the look in his eyes, and then the look in his family's eyes. They were in the room at the same time,
and I'm actually seeing the look in your eyes. I mean, here it is, like 20 years later, and you still
get goosebumps. It's if I had to pick, what makes medicine worth it, it's moments like that. I mean, those are really pretty special, and you cherish that stuff. And
you're giving that guy his life back. I mean, because I can't imagine what it must be like to live in that type of, that type of disorder, if you would.
Right. I imagine it as, you think of, what's the worst sort of nagging pain or issue that you've ever dealt with, and then, sort of multiply that by 10, and then telling yourself, oh, by the way, this is never going to go away. I mean, I just have always tried to put myself in those shoes, and you realize that just has to be exhausting. You really have to be a strong person, over time to learn to adapt and deal with that, and especially like our friend who, through the hardest of times, still had such a sweet, positive attitude. So it is difficult. Any chronic disease is truly one of the hardest things. Is just the fact that it's always there, and anything you can do to alleviate that experience has a huge impact on quality of life, and that's kind of what we're all about. So,
and it must be really, it must feel really good to be able to help treat a symptom and not have to use prescriptions, pharmacology, because you and I both know that there's always side effects to these things, and what do they do when they metabolize in your organs and other issues that could come from that. And you could do a procedure like this, and it's a matter of just turning a switch on.
Absolutely, and while there's always pros and cons to everything, but if you can simplify things and reduce that burden because it's not just the side effects. It's looking at pills every morning, and with Parkinson's, maybe sometimes 5-6 times a day. And that's a reminder of, I have Parkinson's. I'm not well. What is my future? And those are things that you can, kind of alleviate psychologically.
Well, and we're only talking about one treatment protocol for Parkinson's, and we haven't really even defined Parkinson's and other movement disorders. So the music's on. That means we're getting ready to close down our first segment. We got 3 more.
Okay.
I've got Dr. Johan Samanta here in the studio. He's a neurologist specializing in movement disorders, and we have a lot more to talk about, so stick around. We'll be right back. The safety of older loved ones during this pandemic has posed the greatest challenge for many families. Hi. This is Bob Roth, managing partner of Cypress HomeCare Solutions. I know many of you are nervous to choose a communal living option for your elderly loved ones these days, but HomeCare remains the safest alternative. For over 25 years, Cypress HomeCare has served our community, and today we continue to help families by placing high-quality caregivers into their homes that follow the strictest CDC safety and testing guidelines. Cypress Home Care is here for them, and we're here for you. Bathing, meal preparation, medication reminders, and so much more, whether it's a couple times a week or every day. So if you want to keep your loved ones safe and at home, call us today at 602-264-8009 or look us up on the web at cypresshomecare.com.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. I'm your host, Bob Roth, and if you're just tuning in, I got Dr. Johan Samanta here in the studio. He's a neurologist specializing in movement disorders, and we were talking about Parkinson's disease in that first segment. Specifically, we were talking about one of the treatment protocols, which is DBS, which is deep brain stimulation. If you missed that first segment, please go out to our website at cypresshomecare.com. Click on the media button. Third button down is radio show. You can catch that first segment, and you can catch about 400 other shows we've been bringing to you for nearly 8 years. Mm-hmm. So, Johan, I want to get back into talking about some of the movement disorders, especially Parkinson's, but I want our listeners to know a little bit about you. Where are you from? Are you a native? How did you get into neurology? Why did you pick that area, specialty? Why did you pick medicine? What makes you tick?
Oh, man.
Very open-ended question.
I could either answer it in 2 seconds or 2 hours. No, so I'm kind of a Midwestern boy. Grew up outside of Ann Arbor, Michigan. My dad worked at Ford for 20 years, and you were saying the last segment you said something about the brain being the last great frontier, and that's kind of what always got me about neuroscience. I don't think I knew I wanted to go into medicine. I was kind of a sports nut. You grew up kind of in the shadow of the big house and those things growing up. And
sure.
So I thought I wanted to do sports medicine. And then I got a job in college working in the operating room at the Children's Hospital there as a scrub tech. And I realized, man, it was kind of neat and exciting for a little bit, but it was more like working on my car than maybe what I was envisioning, and I got from that I got a job working in a research lab, and they were doing behavioral neuroscience stuff, and that kind of just hooked me. And then from there, everything step by step kind of wound its way, either by design or by luck, towards neurology. And when I got there, I neurology at the time, and some people maybe still think this, but it was considered more of a specialty, and maybe not one in which we did a lot. People had strokes, and you diagnosed their stroke, and that was that. But movement disorders was kind of the area where people were really changing people's lives. You gave people with Parkinson's the right medications, they could move again, they could walk, they could live their lives. You treat people with dystonia with botulinum toxin, which we were using way before all the dermatologists and the plastics guys were taking away wrinkles. And people could see again. People could, they could regain the ability to drive and function
with Botox.
Yeah.
Wow.
Yeah. So
I didn't even know that. I thought it was only for wrinkles.
Right. No. Neurologists are terrible businessmen or business people, I would say. Originally it was developed to treat an eye condition, or what was considered an eye condition, but it's really a form of dystonia called blepharospasm, and people have involuntary blinking and closing, and and it can range from people that just look a little blinky to folks that are functionally blind, even though with their eyes open they have 20/20 vision, but they can't keep them open. They're just, the muscles want to force shut, and there really was no treatment for that until botulinum toxin or Botox came along, and it's, interestingly enough, it was patients would come back and they would say, not only can I see, but everybody thinks I look younger. And that's when the dermatologist said, what? and they took off on the cosmetic side, and neurologists sort of just shrugged and kept treating the neurological stuff. So.
And you never got credit for it.
Yeah.
You guys are the ones that discovered it, and the dermatologists are the ones that made it popular.
Exactly.
And now they have Botox parties.
Right. And I get weird looks when I tell new patients, what you need is Botox, and we have this talk basically.
Right.
It's fascinating. I mean, it basically is, what it does, or the way it works, is it blocks the nerve ending from telling the muscle to contract, and so you have a localized muscle relaxer that you can kind of dial up or down by the dose, and you can select which muscle you want to relax or weaken just by picking out, that's the one I'm going to inject. And
wow. That's fascinating.
And again, you don't need to worry about, like with a pill, is it going to make my legs rubbery if I inject, if I need to treat my neck pulling, or what's it going to do to my liver, my kidneys, things like that. Now 40 years on, it's looking like an awfully safe, obviously when used appropriately, but, that it's one of the safest drugs we've ever had. In point of fact. So, and again, it's something where patients come in, they've been suffering, they've probably seen 3 or 4 other doctors. Some of them have said, oh, it's your nerves, oh, you've got dry eyes, or oh, you twisted, you sprained your neck. And so there's a lot of frustration and not knowing, and then when you can make the right diagnosis and then say, oh, by the way, there's a really good way to treat this, and see them back after their first injection, and see sort of like the sort of surprise and happiness, on people's faces when, I can turn my neck, I can look to the left again. I haven't been able to do that in 3 years, or I can sit and read a book for the first time in how long, or those are kind of why I think most of us, those are the kind of moments most of us were hoping for, we're looking for unconsciously when we got into medicine, so that's part of what I love about neurology in this area in particular.
I watched you again, as you described in the first segment, that one person, and even talking about this, and I really truly see this in you, Johan. You really you practice medicine to help alleviate these folks, these patients of yours, from whatever discomfort or whatever abnormalcy they have to make their lives better.
Yeah, I mean, and obviously, people get into medicine for various reasons. We all have our motivations, but I don't. It was probably not until I was into my career, but I really come to realize, what I like is, I like getting to know patients. I like that bond, and most of what I see tend to be chronic conditions. So I get lots of opportunity to get to know people, and I like to see that what I do makes a difference in somebody's life, and that's really rewarding. I mean, it can be this world we live in can be a bit exhausting, and you can feel really small, but it's nice to be able to get that feeling like, okay, I didn't save the world, but I made a few people's lives better, and that's good enough, I think. Yeah.
I love it. I love it. As we wind down the second segment, we're almost at halftime here. You shared with me the individual we were talking about and this other woman we were talking about, that you were literally on the ground floor in the introduction to DBS here in the state of Arizona. You were training over at the Barrow Institute.
Yeah. So I did my residency there, and then I started my fellowship at what at the time was called the Muhammad Ali Parkinson's Research Center. I think it's now the Muhammad Ali Parkinson's Center. But and my mentor at the time, who was Dr. Mark Stacy, and he's now the dean of the medical school at East Carolina. So he's moved on to bigger things at least. But he came to me on my first day of fellowship, gave me these two, 4-inch thick binders, and said, "Here, this is the start of the IDE, the Investigational Device Exemption application to the FDA, for us to be able to do deep brain stimulation surgeries for Parkinson's patients. Your job is to finish this up and get it sent out to back to the FDA for review in the first, in the next 30 days." And so that was my first project as a fellow.
Wow.
There. So
We're at halftime here. You're listening to Health Futures, Taking Stock in You. I've got Dr. Johan Samanta here in the studio. I want to talk a little bit more about your practice, because you're in private practice now, so stick around. We got one more half to go. We're at halftime.
All right.
I finally had to take the car keys away from Dad this week.
I don't think Mom's been taking her medication, and I'm concerned.
I can't juggle work, my kids, and go look after my parents. It's just too much.
Do you need help taking care of a loved one? Cypress HomeCare is here for them and you. Bathing, meal prep, monitoring, errands, and more. Call Cypress HomeCare 602-264-8009 or go to cypresshomecare.com. Cypress HomeCare. Help is here.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and if you're just tuning in, we're in our second half here, and we got a lot to cover. I got Dr. Johan Samanta here in the studio. He's a neurologist specializing in movement disorders, and we talked about a lot in the first and second segments. Talked about Parkinson's. We talked about Johan's background and how he got into neurology and movement disorders. We talked about a couple treatment protocols, DBS, which is deep brain stimulation. We also talked about Botox, and who knew that Botox origins really started with neurologists and not dermatologists. So we're here in the second half, and when we close the first half, we were talking about your fellowship training over at the Barrows Neurological Institute, and really where you got a chance to really start the research work on deep brain stimulation. You talked about this big binder that was given to you, and I'm sure back in the day that was pretty overwhelming.
Yeah. The only thing is, you have the ignorance of what you're getting yourself into as your advantage. So you just say, oh, okay, and and you kind of go from there.
And coffee.
Yeah,
Lots of coffee.
lots of coffee, and thankfully, I had. I got a lot of advice from colleagues, other neurology groups, at different centers around the country that were in the middle of the same thing, and it worked out. We were able to get, actually, I think, one of the largest numbers, of patients approved for that initial study.
Nice.
I think it was 50 patients, which was, I think, a lot of centers had only been able to get an approval for like 20 patients, 30 patients. I don't know that there was anything that I wrote particularly. I think I was just, again, naive enough to ask for 50, and I didn't say anything egregious enough that they wanted to cut it down, and so
They gave you 50.
They gave us 50, and we
Nice.
never looked back. I think, I know they've done more than 1,000 implants at least, since then. The current surgeon who I've had the pleasure of working with, and that I think is one of the best in the world at this, Francisco Ponce, I think just recently did his 600th.
I've
something
heard
in
of
that
him,
range.
yes.
Yeah. So we're incredibly fortunate in the Valley that, at least when it comes to treating Parkinson's, actually treating a lot of neurodegenerative disorders, we have some of the most talented and decorated members of the community out there. So,
Well, you mentioned, I think it was Dr. Stacy.
Yeah.
And you and I talked at the break. You talked about Muhammad Ali, and I mean, you said it best. He is the original GOAT. There is no doubt about it. And for those that don't know what GOAT means, the greatest of all time. He really was the greatest, and they even wrote a song about him, which is really phenomenal. And I've had a chance to meet him as well. But that institution really was developed and fundraised through his efforts, and we mentioned the other doctor, Dr. Abe Lieberman, who I got a chance to meet as well, and he's kind of a rock star in getting that started too.
He's he's a legend. Just Abe finally sort of acquiesced to his wife and
right.
retired.
It was like 2 years ago. Yeah, I can't believe it.
But he's actually, I think he's the only neurologist I know of that is that's an answer on a Trivial Pursuit card too. So he's actually. He was the one that figured out that, and I think convincingly showed that Adolf Hitler had Parkinson's disease.
Wow!
And so that was one of his real. That was sort of what put him on the map. Fairly early on in his career. That, along with, I think, a really, really strong drive in new therapy research, and so. Yeah. So we had I remember him having the framed answer and question cards in his office for years when I was a resident. So
Trivial Pursuit.
Yeah, that Trivial Pursuit card.
I love it. Do you remember what the question was?
Yeah. So I think it was this doctor it showed that or proved that Adolf Hitler had Parkinson's. I mean, it was something just basically, but. The guy that figured out that Hitler had Parkinson's, more or less. And so you flip it over, and there it is, Abraham Lieberman.
And it's what I would refer to as useless information, right? I mean, I would think that it would be for Muhammad Ali because he was his doctor, right?
Right, yeah. Though I guess, it's one of those things where I'm sure several doctors over the years would have claimed that. And
right.
So,
There you go.
Yeah. Who amongst us is a Trivial Pursuit answer, though? That's not too bad.
No, it isn't. Not at all. Not at all. So, you've talked about a lot of disorders, and one, first of all, if you could just frame for us, Parkinson's. What is Parkinson's? Are there early signs that you get? Is there a way to you know, like, I know, and you and I talked at the break about Banner Alzheimer's Institute and some of the genetic studying that they're doing. Is there genetic studying you can do with Parkinson's and say you might be predisposed, or are there early symptoms that you're looking for?
Sure, sure. And Parkinson's, just to sort of quickly frame it, is a neurodegenerative disorder that essentially is sort of defined by an early loss of dopamine producing cells in the brain. And it's that loss of dopamine that inhibits function and causes kind of the three cardinal symptoms. And those are rigidity of your muscles, slowness of movement, and probably the one that most people think of and that's tremor, and it's a resting tremor. So these are the folks that are sitting, and you look down at their hand in their lap, and it's kind of just going, or the finger or the thumb is kind of going back and forth, and those are the core symptoms. But even before that, what we've come to realize is Parkinson's, probably those changes have been going on for years, if not decades, before somebody develops those motor symptoms. And they can, and they really start from the outside in. So there's the vast majority of patients with Parkinson's have had a loss of sense of smell over time, maybe many years, often before they develop symptoms. They have changes in their bowel function, so constipation, chronic constipation without any other real explanation. And they have sleep disruptions, so they tend to have more vivid dreams. They tend to, yell out or act out in their dreams, something we call REM behavioral disorder. So it often, so that combination or that trio, is increasingly looking like a strong risk factor for someone who may develop Parkinson's down the road.
Can you do a test? I mean, can you go in? And again,
Right.
for our audience, I'm just asking questions because I
Absolutely.
don't know.
So it'd be wonderful. Unfortunately, there still isn't a blood test or an X-ray. It is down to the history and the clinical exam. But the statistics tell us that if with an experienced neurologist, somebody who has, experience seeing Parkinson's patients, that the accuracy for what we call a clinical diagnosis is about 90% compared to autopsy. And you know what? I'm not ready to go get an autopsy, so I'm going to go with that. So, or at least that's what I tell my patients. Some of them laugh.
No, listen, I was inquiring because I was really curious. As we wind down this segment, we got about 30 seconds more. It's interesting to me, just, a lot of the symptoms that you talked about. And one I want to talk about, and we can either get started and we can finish it now or get into in the fourth segment, is like freezing is one of those symptoms that you have. And,
Yeah.
And I find that fascinating that, somebody can literally be stuck.
Right, and it's it's a really complicated issue, and there's physics that comes into this. There's angles and centers of gravity and momentum, and there's a lot of just sort of not quite right circuitry. When that's not working, it makes it very hard to do something so natural and unconscious as that.
Wow. Well, we're down 3 segments. You got the music going. We got a little. What do we got going there, James?
Kudos to the DJ.
Guns N' Roses.
Guns N' Roses.
Yep.
There you go. Welcome to the jungle.
Yes.
It is a jungle out there. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. I got Dr. Johan Samanta here. We got one more segment. Stick around. We'll be right back. The safety of older loved ones during this pandemic has posed the greatest challenge for many families. Hi, this is Bob Roth, managing partner of Cypress HomeCare Solutions. I know many of you are nervous to choose a communal living option for your elderly loved ones these days, but HomeCare remains the safest alternative. For over 25 years, Cypress HomeCare has served our community, and today we continue to help families by placing high-quality caregivers into their homes that follow the strictest CDC safety and testing guidelines. Cypress HomeCare is here for them and we're here for you. Bathing, meal preparation, medication reminders, and so much more, whether it's a couple times a week or every day. So if you want to keep your loved ones safe and at home, call us today at 602-264-8009 or look us up on the web at cypresshomecare.com.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and if you're just tuning in, we're on segment number 4. I got Dr. Johan Samanta here in the studio. He's a neurologist specializing in movement disorders. And if you missed the first 3 segments, go out to our website at cypresshomecare.com. Click on the media button. Third button down is radio show. You'll catch this show and many more. So, Johan, I want to talk about freezing. I want to talk about I want to talk about this COVID thing and how you guys have been operating and some of the neurological challenges that come along with that. And then I'm going to leave it open to you to kind of close us out. Okay. So freezing, and that's, I don't know if it's uncommon or common, but it does happen to Parkinson patients.
It does. It tends to be an issue that develops the longer you've had Parkinson's. So folks that are a bit more advanced or you know, where they've been dealing with the condition longer. And
just so our audience can visualize this can happen to a patient, let's say, you know, grocery shopping, and all of a sudden they take their cart, make a turn, and they just stop.
Right. So it's it's usually with kind of initiation or a transition. So you start to turn and one foot just doesn't want to leave the ground, or you stand up and you get ready to walk and your feet seem to be stuck. I think if anybody's ever seen the movie Awakenings, there's sort of there's a scene in there where they kind of do a pretty good, I think, portrayal of that.
That was Robin Williams, right?
Yeah, Robin Williams
and
and De Niro. Yeah, exactly.
I remember that movie.
So 2 of my favorite actors, and and there's that scene where Robin Williams kind of figures something out, and he starts making these marker marks across and he makes a checkerboard marker.
I remember
and then he
that.
Tells, and I think it's one of the other patients, and he has her. She can't walk, but he shows her that it gets her up on the floor and says, "Step on the black, tiles or whatever." And with that visual target, she can do it, and she walks all the way across the room for the first time in I don't know how many years.
Wow.
And that's it seems bizarre, but it's a real phenomenon. So there's something that happens, this part of the brain that's affected in Parkinson's is kind of like your autopilot and maybe an automatic transmission. Sort of, you think of those two things sort of melded together. So, we learn how to walk as toddlers, and then we don't have to think about it anymore. Well, because this circuit's doing it for us. And so what happens in Parkinson's is maybe if there's a little bit of hesitation or you get your center of gravity a little bit out ahead of your feet, the rest of that circuit isn't there to correct, and your feet don't quite know what to do. And suddenly they're stuck. And our inclination, our instinct is just to sort of power through. And that doesn't work because we don't have that circuit helping us out anymore, that autopilot. And what you end up, what I've found and what we sort of teach patients is, first thing you have to do is recognize, I'm freezing, I'm stuck. Then you have to stop and really reset your center of gravity. So invariably these folks have kind of shifted onto the balls of their feet, and so it's kind of like a little kid trying on mom's high heels, and you know what they look like when they're walking? They shuffle, they look kind of coordinated, and they're teetering. And so your brain thinks you're teetering, and it's not going to move. It's just trying to keep you from falling on your face at that moment. And so if you can stop and just get your feet flat and start over, it's amazing what it can do. And what we've seen is, And I think this is also why we're realizing exercise and activity and strengthening, and those things are so important in delaying or slowing the effects of Parkinson's. Is, you need to be able to stand up tall, and part of that whole, stooped posture thing that happens in Parkinson's also kind of conspires to cause you to freeze and cause you to, because it throws your center of gravity off.
Could be that Big and Loud program that they got too, which is
Big and Loud is is one of the great things that's come along in the last 10 years.
It is amazing.
Yeah.
So we had a former NFL player, a former college All-American as a client, lovely person, and his significant other was amazing too. You should have seen. This is a guy who's about 6'8", 6'9", with my caregiver who was literally like 4'10", and her leading the Big and Loud cheer. And just so our audience knows, I mean, one of the side effects too with Parkinson's is they don't speak loud enough, and they think they're speaking loud enough, but you have to retrain them to really exert their voice so they can be heard.
Exactly. It's that, and again, it's that autopilot. In your mind, you think you're taking a deep breath, you're projecting, and you're giving the same effort, but what translates to your diaphragm, your vocal cords, and that is some smaller percentage, and there you are, sort of at the end of your breath, running out of air, not projecting and mumbling, and that's what happens in Parkinson's.
So the name of your practice is MDS Docs, right? Or that's what's up on your website.
Yeah, that's our website address, and so we aren't truly a practice. We really just share space. But there's two of us that are Parkinson's specialists that have our office up by the Squaw Peak area.
Dreamy Draw.
Yep, I think it's the best street address in town.
I
it's
agree.
my favorite. So
I agree. Dreamy Draw, and I've got a web address, mdsdocs.us.
Yes, that's our website.
And a phone number is 602-277-2228.
Yes, so it's kind of a nice repeatable phone number. I was glad when we got it, because I could remember it. So,
so we're winding down our segment. I want to close by asking you what COVID has been like. We got about a minute left for you, and some of the neurological early signs there are, and then if we can just give a final lasting comment.
Absolutely. COVID has been sort of just a devastating event for everybody, but what we've had to do is really rearrange how we see patients. We're except for new patients or patients that need programming or Botox injections, we're doing all of our follow-ups by phone or video, and thankfully, because Parkinson's is, and these movement disorders are kind of chronic, we know each other. We can talk, and I can hear, and I know the patients know, what I need to find out, and a lot of what really matters isn't what I see in the office on a follow-up. It's what has been happening to the patient since I last saw them. So thankfully, we're in a position where I think we haven't lost a lot in terms of our ability to care for patients and make good decisions on their behalf or give good advice, but it has been a challenge, and it's certainly been a change.
What percentage of your clients now are you seeing via telemedicine versus in person?
So, with the exception of injection day, we have one day when we do Botox, but on the other days, it is probably 80% are done in some form of remote access.
I need to have you back because I want to find out.
I'd love to be back.
I want to find out, how that is meant to you. Well, we are done.
Wow, that went fast.
Dr. Johan Samanta, thank you for being on the show. Make it a great day.
Absolutely.
Have a great weekend. We'll definitely have you back.
Thank you for having me.
You got it.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress HomeCare Solutions at 602-264-8009. That's 602-264-8009. Or or visit CypressHomeCare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.
I finally had to take the car keys away from Dad this week.
I don't think Mom's been taking her medication, and I'm concerned.
I can't juggle work, my kids, and go look after my parents. It's just too much.
Do you need help taking care of a loved one? Cypress Home Care is here for them and you. Bathing, meal prep, monitoring, errands, and more. Call Cypress Home Care 602-264-8009 or go to cypresshomecare.com. Cypress Home Care. Help is here.